Arizona continues to struggle to support our families and ensure every child in our state is supported, safe, and thriving. The Department of Child Safety receives an average of 80,000 reports of suspected child abuse and neglect each year. These reports don't end up being about child abuse. They're about a family that needs support, not a government intervention. In Arizona, parents and caregivers don't have a simple way to find what they need to keep their family safe and stable, especially in times of stress. When they can't find what they need, they're more likely to become a DCS report. So, what's being done to address the issue? DCS has implemented new policies to differentiate between child maltreatment and when a family simply needs a resource. Family and child advocates are working together more closely than ever to help families when they need it most. But why aren't we seeing quicker results? We have a complicated and sometimes frustrating system of service providers that's hard for families to navigate. It's even hard for professionals who support families to find out what's out there to help. There are numerous websites, call centers, lists, and resource guides. It's difficult to know where or how to start. We've seen some of these challenges unfold. A quick Google search for Food Box Phoenix returns endless results without any real guidance about where to start. Also, there's a continued reliance on DCS to provide services to families, the same agency that takes custody of children, and this presents a very real trust barrier. Arizona is getting better in this space, but there's more work to be done. So what's the solution? We need to recognize that parenting is stressful, even in the best of times. Many families are stressed, under-resourced, and don't have the time to navigate the sea of resources that are available. That is where the VL Impact model can make real, systemic, and lasting change. Our model sets up leaders to understand the upstream root causes of childhood adversity. We create the space for leaders to develop solutions for those systemic issues. For example, we've built an innovative chatbot that helps families get what they need so they can avoid crises that may lead to the long-term consequences of DCS involvement. That's what the VL Child Wellbeing Impact team is doing. In partnership with leaders in this space, we've co-developed a fast, anonymous, and statewide AI-based chatbot that connects families with food, clothing, and phone resources. The team is leveraging the chatbot with on-the-ground providers like family resource centers to make it as easy as possible for families to feel supported and have their needs met. What's great about the VL Impact model is that it can be replicated and expanded. We've created a new model for how to harness the power of data and AI to help people. We have a long-term upstream goal in mind, not just another band. We also understand that our biggest challenges can be our greatest opportunities in the Arizona child well-being space. More people can contribute to their communities when they have less to worry about when it comes to providing for their families. When we seek to support families, we're taking a long-term approach to making sure their kids are thriving now and are successful in the future. And we can save money. There's a significant social return on investment when families don't have to interact with DCS. For example, in other states, data has shown that for every dollar invested in a family resource center, there's almost $5 in social return. The problem is big, but it's not too big to solve. It's about creating a transformational tipping point and new ways to make sure every child and family in Arizona can thrive. Want to be part of this innovative model for getting things done? Learn more about our team's work at impactmakeraz.org.